been reporting there is now a new option to detect early signs of colorectal cancer. The FDA has approved a simple blood test that could replace colonoscopies and stool samples for a lot of patients. Here to talk more about this is Dr. Andrew Chan, the Director of Cancer Epidemiology at Mass General Hospital. Thank you for being here, Doctor.
Hey, Doctor, it's great to see you. So question one, right off the bat, let's start with the test. In your eyes and what you've seen, what you know, how accurate is it?
Yeah, this blood test is actually quite good at detecting cancers early. They recently completed a clinical trial of over 10,000 people and showed that they were able to pick up about 80% of cases of colorectal cancer, which is really quite encouraging.
So 80% is very encouraging. How does it compare to the other screening options?
Well, compared with colonoscopy, which is the gold standard for screening, this blood test is still not as good at picking up polyps or growths that have the potential to become cancer over time. But it is a good option for people who do not want to have a colonoscopy.
And Doctor, let's further explore a little bit of that, because as you know, many people just don't seem to like many of the options. So what do you want them to know? Is this a viable option for those people?
Well, we say that the best screening test is the one that actually gets done. So, if you are reluctant to have a colonoscopy, it means that you should, think about this as a potential alternative. But we do want people to recognize that if you have a family history of colorectal cancer, or if you're having any kind of symptoms, this may not be the test. So you really should talk to your doctor about that, because I think in that case, you really should have a colonoscopy.
So are you going to give your patients, doctor, the option of this, or are you just going to say, do you first say colonoscopy first and then we'll take it from there? What are you doing?
I think everybody should sort of be offered a kind of a menu of options. I think they should, discuss the possibility of having a colonoscopy. And if they're willing to undergo the procedure, that would be the one I would choose. But if there's any reluctance, or if there's other issues with respect to convenience or other aspects of the test that they don't find attractive, then I think this should be offered. So I do feel like it's going to be another tool to really get people screened.
Doctor, thank you for your time.
Thank you, doctor. Important subject, that's for sure. Thank you.